So this is Alan. Alan is here for, has been coming for a rotator cuff injury, combined injury. And that goes back a ways, doesn't it?
Yeah, it goes back to, well, I had been having pain from wear and tear from abusing my body for a lot of years. And then I was in a car accident. I was rear-ended. And I took, you know, I used to drive like this. I still drive like that. And I took the and I took the impact in my shoulder.
Yeah.
And then shortly after that, I went bowling with my son, and when I threw the ball, it felt like my arm was going to get ripped out of the socket and travel down the alley with the ball.
Yeah.
So it seemed like a good time to get that addressed. And my just everyday doc path referred me to you for prolotherapy, and we did some prolo with PRP, and I think it was 5 or 6 treatments over about a year. And then based on that, my shoulder felt better than it did probably for 10 years before that, to a point where I'm now back into competitive swimming, and I'm back into the gym. I do butterfly when I swim. So it's it's pretty good. And then of course I tweaked it again stupidly in bed, but that's another story.
Yeah.
I think for me, I'm fortunate that I kind of travel the naturopath route. Otherwise I probably would have been told I need surgery. But because my regular doctor is a naturopath, he defaulted to this first rather than the slice and dice your shoulder approach.
That's right. That's right. Yeah, so now you're back competitively swimming, and it's pretty fun.
Competitively swimming with masters. So yeah, and yeah, it's neat. I mean, when I got back in the water, I could barely knock out 1,000 yards. Now my workouts are 3,500, and they feel good, and my shoulder feels good. So
very good. Well, thank you, Alan, for telling your story.
Sure.